Alright guys, back. We're here doing another drug. We're going to enter the steroid era. Here we go. And we do use steroids in the back of our ambulance. And again, steroids reduce inflammation due to swelling as well as, so it helps you repair faster. But the one that we're going to talk about very specifically is methylprednisolone. And of course, that's better known as Solu medrol. But if you ever get the chance to, if somebody ever pops prednisolone on you on Scrabble, you can counter with the methylprednisolone, and that's a 29-point Scrabble word. Somewhere in there, you're going to hit a double or triple word score. You're going to make somebody cry. All right. So with that being said, again, this is the chemical makeup of methylprednisolone. Have that memorized by at least an hour from now. Definitely not. But what I do want you to know is how we use it and what it does. So it's also known as medrol. The most common is Solu medrol is what we usually get. Now, this guy is used. It treats severe inflammation, which is caused by certain conditions, to include severe asthma, allergies, anything that swells the area. We can also give it for other swelling situations where we want to reduce inflammation. That's where we would give it. So again, it is a corticosteroid and it's an anti-inflammatory drug. That's why we actually give this drug to people. Usually when they're having a COPD exacerbation or an asthma exacerbation, we give this to reduce the swelling in the airways, which again allows more air passage. Now, one of the things I will say about this drug is that it kicks in very slow. So that's the problem. And the sooner we get it on board, obviously, the better. And we'll talk about that when we get to onset and duration. So again, it's a synthetic one. By the way, it's got some ugly cousins out there like Solu-Cortef. There's some agencies that do use that in the area. The principle in which it works is fairly much the same. It's just different dosing for that particular drug. But it inhibits the swelling, ischemia, and nerve cell death, but with spinal cord trauma. When I first started in the business, as a matter of fact, we had a confirmed spinal cord break. You would give, and they still do it in the hospitals, large amounts of steroids to help reduce the swelling to the tissue so that it would save the nerve tissue. We also used to give large amounts, by the way, or even use Decadron on that one for your brain swellings. Suppresses immune response. That's the other thing it does. And when your patient finally gets hit with a Solu medrol, you got to go whole Hulk on you. No, it doesn't exactly work like that. So it usually takes 1 to 2 hours, and depending on which book you read, some of them actually go out even farther before this actually kicks in. My point is that it kicks in, it takes some time to start working. So with that being said, getting it on board early, this is the patient that you give it to, you have an hour transport, and by the time you get them to the hospital, they're doing great. And they're like, well, why did you bring him in? Well, because an hour ago that he wasn't this way. Again, it lasts 3 to 24 hours, so most of the time for us, we only have to dose them once, okay? So again, we use it for severe allergic reactions or anaphylaxis. We use it for bronchodilation effects for asthma and COPD patients, and again, our spinal cord injuries to help keep it down. This is your old guy who wasn't barely breathing when you get there, and guess what? All of a sudden, they're feeling better now. It's got very few side effects to it. There are some, but the biggest ones are, is the minor side effects, a little bit of malaise, headache. You can get some mood swings with it. If you're a diabetic, it will send your sugar through the roof. And again, it does increase intraocular pressure, so we got to be careful with that. Guys, when you give this, remember, it reduces inflammation, and when you have wound healing, that's actually a bad thing. So again, and it can cause some hiccups, by the way, so that's another one that's kind of normal. If they have a fungal infection, you absolutely 1,000% need to stay away from any corticosteroids, because you're going to cause that fungal infection to increase exponentially. That you don't want to have happen. We usually don't give this to neonates or premature infants. Again, that we don't do it. It has very adverse effects. Diabetics and GI bleeders. Again, we just talked about it. It sends the sugar through the roof, and again, it reduces inflammation. And in the case of a GI bleed, the inflammation is a good thing because it's usually stopping the bleeding. Yeah, I absolutely had to put this on here. You always have to put a Star Wars meme in there. So again, they can't hit anything. And by the way, so speaking of that though, again, remember when we get this drug, it's usually got the powder down here, and it's got the liquid up here, and you have to push this orange cap down. That's going to push a plunger down. It's going to allow you to mix these two, swirl it together until all the solid is gone. All right, so again, if you got hypoglycemic response to insulin, it might be inhibited, so actually it raises blood sugar, okay? I can't stress that one enough. You give somebody a steroid, it's going to send their sugars through the roof, all right? Potassium depleting agents, it can cause hypokalemia, and that's again because it reduces inflammation, which opens up usually the loop of Henle, which allows them to pee a little bit more, which unfortunately will cause them to lose more potassium. Again, using caution with Cushing's syndrome, not to be confused with Cushing's reflex. Cushing's syndrome is a thyroid condition syndrome. And gastric ulcers, diabetes, again, you got to use it with caution with the diabetics. And if they do go psychotic, if they've got a psych history, I'd be really careful. Because again, you can start, they get mood swings with it really good. Again, the patient, you got to watch them for blood sugars. Again, don't give it to a kid, a baby. Absolutely don't give it to a baby. Matter of fact, most of the time we don't give it to kids. Spinal injury, if you don't give it within the 8 hours, don't bother. You're not going to get the good effect with it. So again, this is how we usually get it. We usually get it at 125 milligram vials. That's our common dose, is this guy right here. That's what it normally is. And so we usually give, for spinal cord trauma, it's 30 milligrams per kilogram, over 10 to 20, followed by a maintenance drip, okay? Good thing we usually don't use this anymore. For asthma and COPD, it's 80 to 250 milligrams. Notice that there was 125 in the vial. Most protocols I've ever written is 125 of Solu medrol. And then again, your length-based tape for pediatric doses, if you do give it, I don't know of any protocols in our area which actually allow us to give it, but it's 30 micrograms per kilogram that you would give it. Again, smaller amount there is probably the better thing. You can't give it IM, by the way, so even if, and remember, it takes 1 to 2 hours onset, so giving it IM actually is not necessarily a bad thing. Again, you can give it, just remember that they got a lot of fluid in there, so you might have to split the shot up into 2 shots, because again, you're going to have to put it into a big muscle. And pregnancy doesn't really, no real establish it. It does cross over the placental barrier, so it can cause problems there. All right, that's it for Solu medrol, and I'll see you all in the next one.